Hi, class. Today we're going to talk about cultural diversity, the patient as an individual. Let's look at the definition of cultural diversity. It refers to the unique characteristics that all of us possess that distinguish us as an individual and identify us as belonging to a group or groups. Diversity transcends concepts of race, ethnicity, socioeconomic, gender, religion, sexual orientation, disability, and age. Diversity offers strength and richness as a whole. What factors influence diversity? I think this chart speaks volumes. When you look at this chart, you look in the center of the pie and it shows you physical abilities, qualities, your age, sexual orientation, ethnicity, race, gender. And then on the outside of the hamster wheel, you can see all of the different influences that could change what you decide you want your race or ethnicity or physical ability to be. For example, military experience may reflect on your physical ability. How well do you do in physical activities or your qualities? Would you be successful in a military experience? I find this slide as a great visualization. Let's continue. Cultural diversity, you hear words such as stereotype and generalization. Stereotype, qualities assigned to people based on their race, religion, national origin, sexual orientation, etc. No attempt is made to learn whether the individual in question fits the statement. Stereotyping patients can have negative results. A prime example of stereotyping would be if I read the patient's chart ahead of time and I see that the patient is listed as a poor historian. I automatically am stereotyping and assuming that the patient has no insurance. Why would we do this? Because we've seen other patients set the same example. We are officially stereotyping patients that have listed as a poor historian is having little or no insurance. Now let's look at generalization. It indicates common trends, but further information is needed to determine whether the statement is appropriate to the particular individual. Generalizations are usually inaccurate. So let's say we have a patient that comes in and the patient has multiple tattoos and the patient has piercings. Right away, I'm generalizing this group of patients as being irresponsible or these patients can't hold down a job. I'm generalizing this group of patients strictly on the way that they look and not getting the appropriate information to determine who they really are as a person and not what they look like on the outside. Prejudice, something that prevents objective consideration of an issue or situation. Again, the example, a gentleman comes in with tattoos and piercings right away. I'm prejudiced. I'm judging him on what and who I think he is as a person solely based off of his appearance. Discrimination, unfair treatment of a person or group based on prejudice. I don't really have to go into discrimination as I think we have all been um, exposed to some form of discrimination in our lives. Values, things that we hold as important. Each culture has their own values. Independence and autonomy are things we value in healthcare. However, patients often make decisions after discussion with their family. Privacy, by limiting visiting hours, which has changed recently due to COVID. Modesty and efficiency, keeping our patients covered, etc. Self-control. While in healthcare, we value self-control. Many cultures believe it's normal to express emotions. Just remember, when we think of patients and their values, keep in mind the patients that come in and they will not accept blood products because it goes against their religion. Ethnocentrism, the view that one's culture's way of doing things is the right and natural way. Feeling that other ways of doing things are unnatural, inferior, or barbaric. You will have patients that come in and they are going to argue with the way that you do something. It is okay to explain to them that there's different ways to do things and making sure that the patient is okay and gets your consent with the way that you're doing things. If they feel uncomfortable, try other avenues. If you need help, call in a coworker and ask them to help you to explain to the patient a little bit thorough so that the patient feels comfortable and they are not feeling as though something is being done to them that is unnatural. Cultural relativism, the attitude that other ways of doing things are different but equally valid. Ideas on disease process. Most people think that germs cause disease. Some cultures have different beliefs on the disease process, possibly upset in the balance, loss of soul, possession by a spirit, breach of rules, or a taboo. Now I want you to take a look at this slide. It's some examples of cultural issues in healthcare. Let's take a look at the first bullet, taking a history. Some cultures don't like to give out too much information. Only ask the patriarch of the family. Some cultures, they expect you to speak to only the man of the family or the father of the family and no one else. You respect the decisions that the family makes. Second bullet point, eye contact. Some cultures do not allow people to look in the eye of someone who has more authority than them. Eye contact implies equality. There are some cultures that will not make eye contact with you, and that is okay. They are just minding their culture and the way that they do things. They are not meaning or showing any disrespect. Third bullet, language. The most significant issue is the lack of the same language. Other issues revolving language in a way that a person speaks to someone. Some cultures don't like a younger person to tell them what to do. Touching. This goes beyond gender. People have differing levels of comfort as it relates to touch. Some cultures avoid touching between genders and physical contact is infrequent. You will find in the hospital setting or any healthcare setting that there will be some cultures that they do not shake your hand. They will not look you in the eyes. It is just them honoring their culture. They are not trying to disrespect you in any way or try to disregard your title. It's just their way of fulfilling their cultures that they're used to. Let's take a look at the last bullet, food. Some cultures take food on the first offer, while others wait until the second offer, first being out of courtesy and the second being sincere. Some patients just are not used to the food that we are used to. They find it insulting that you would offer them certain food. If the patient becomes hungry enough, they will accept the food or they will have family members bring in food that they are used to. This last, second to last slide is a general. Chirophones and in-demand video used for patients who do not speak the native language. In some healthcares, they're called SURIs. In some healthcares systems, they're called MARTIs. It depends what facility you work in, but by law, all healthcare facilities must have a cryophone or a MARTI or a SURI that if you have a patient that comes in and does not speak the language, that you are able to communicate with them through an interpreter. All right, class, last slide. The 6 areas of human cultural diversity that healthcare providers need to understand to assist their patients. Keep in mind this slide and the 6 areas: communication, space, time, environmental control, biologic variations, and social organizations. This concludes cultural diversity.